for, I'm an education and outreach coordinator for the Women's Fund. For those of you who may not be familiar with the Women's Fund, we are a not-for-profit organization located in Houston, Texas, and our mission is to provide health education for women and girls and provide them with the tools they need to be advocates for their health. So we do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. Our programming and publications are completely free. If you've never had an opportunity to visit our website, thewomensfund.org, I encourage you do. You can find PDF versions of all of our publications, as well as a form to download for physical copies if you're interested in physical copies. So we're going to go ahead and get started with today's presentation. We are very, very excited to have Dr. Thomas here speaking with us over Alzheimer's in your brain. So a little bit about Dr. Thomas. After graduating with honors from the University of Texas at Austin in 1995, Dr. Thomas went on to the medical school at Baylor College of Medicine. In 2001, she completed her internship at the college, and in 2004, completed a neurology residency at Atlanta's Emory University. In 2005, she completed a neurophysiology fellowship that focused in electromyography. Dr. Thomas says she chose to be a neurologist because she had excellent mentors and her mom's history of intractable migraines. Dr. Thomas is a member of the American Association of Neurology. She enjoys spending time with her daughter and two sons. She also enjoys reading, going to the movies, and trying new Tex-Mex restaurants. She especially likes to travel and visit zoos in different cities. So I may have stumbled through that introduction and I apologize, but wow, we are very excited to get to this presentation. So Dr. Thomas, I'm going to turn the floor over to you.
Okay. Well, hello, everyone. I'm glad that you're able to join us today for this little talk. We'll be talking about memory and specifically Alzheimer's dementia. And I plan on talking for a little while, but my favorite part of this is the question and answer so that you can ask me what you would like to know. So get your questions ready. So you can go to the next slide. So I work over at Kelsey-Seybold Clinic. We have locations all around Houston. Specifically, I work in the Med Center, and today I'm at Katy Clinic, and then I also go to the Sugar Land Clinic in Fort Bend. So if you need to find me, that's where I'm at. You can go to the next slide. What is dementia? Dementia is when you have problems with your memory or your thinking, but it's when it starts to affect your day-to-day function. So it could affect your ability to drive, you're getting lost all the time, to cook, to handle your own finances. It could affect your ability to remember important dates. You could forget your anniversary, which sometimes we do anyway, or birthdays, that kind of thing. So there's memory loss, and if it gets bad enough where it's affecting your day-to-day living, then that's when we label it dementia. You can go to the next slide. So a lot of times people think that all dementia is Alzheimer's, or they think that dementia and Alzheimer's are two different things. So I wanted to clarify that. So Alzheimer's is a type of dementia. I've had people that had dementia and they're happy that they don't have Alzheimer's, but sometimes it is Alzheimer's. So most of the time, if you have dementia, it is Alzheimer's. As you can see, that's the greatest percentage of dementia. But there are some other types of dementia. Some people have dementia because of vascular reasons. Their brain hasn't been getting enough blood, or they've had multiple strokes, or maybe they could have had some kind of heart problem or breathing problem where their brain didn't get the oxygen that it needed. And so that can cause changes in the circulation to the brain and then cause dementia. There are some other dementias. There's one called frontotemporal dementia. And that type of dementia, people have a lot of problems with doing day-to-day tasks. They could have some hallucinations. And then there's Lewy body dementia. The actor Robin Williams had that type of dementia. And that also can make you have a lot of hallucinations or paranoia. Lewy body dementia can also mimic some of the symptoms of Parkinson's. So you might have tremor and difficulty walking. And then lastly, there's other diseases that is part of the disease. You can have dementia like Parkinson's or some other things. And then sometimes people have a mixture of things, which makes it more complicated. So for the most part, the treatment of dementia is very similar for the different types of dementia, but sometimes knowing which type you have can help us a little bit better know how it's going to progress, because some of the dementias are a little bit more aggressive and faster, and some types of dementia are a little slower. So that's why we try to figure it out. You can go to the next slide. So let's talk about Alzheimer's in particular, because like we said, that's the most common reason why people have dementia. You can go to the next slide. So there's three major parts of your brain: the cerebrum, which is the majority of the brain, the cerebellum, which is the back that helps us with our balance, and then lastly, there's the brain stem. And that part of the brain does a lot of the automatic functions like helping you breathe, regulating your heart rate, and those kind of things. But in this slide, it tells you that the average brain is only 3 pounds. So it's a fairly small thing, but it has such important function. And the amazing thing to me, which is the reason why I'm a neurologist, is just fascinating to me that something that's just almost like the consistency of jelly could help you think, help you move, help you talk. It's just really amazing how that works. So next slide. So when you have Alzheimer's, it can cause a lot of shrinkage of the brain. And in particular, there's parts of the brain that shrink more, mainly the memory areas, which is why you have memory problems, but it can affect the whole brain. So sometimes we think of it just as being memory, but there's other things that the Alzheimer's can affect. Interestingly, though, you can have people that have a lot of shrinkage and very little memory loss. And then there's other people that have hardly any shrinkage and have a lot of memory loss. So a lot of times people, when they're having memory problems, they expect to have a scan, like a CAT scan or MRI, and that's going to tell us all we need to know. But the most important part of the examination is really talking to you and finding out what you're having a hard time with, finding out what your friends and family have noticed or coworkers, and talking about the symptoms, because we can't just look at your brain and spit out a diagnosis. We have to pair that with talking to you and getting your symptoms. Okay, next slide. So people don't go from having a little bit of a memory problem to having severe dementia where they can't take care of themselves overnight. It's a process. And so we are usually trying to figure out ahead of time when the symptoms are very minimal at that point and try to intervene then. If you wait too long, then there's not a lot that we can do about it. So sometimes it can be hard to know when to worry. So there's what's called mild cognitive impairment, or we call that MCI, where you have more memory loss than you should have for your age, but you don't have enough to call it dementia where it's really impairing things. So for instance, it's normal to go into a room and forget why you went in there. But if that's happening every time you go into a room, that could be a problem. Or it's normal maybe to misplace your keys, but what if you find the keys in the refrigerator, or you find the keys in the dishwasher? You know, they don't belong there. So sometimes it's not so much just the symptoms, but the severity of the symptoms that helps us determine. But it can be very difficult sometimes at the beginning to know if this is normal for your age or not. So how do we figure that out? Again, it's with questions. So when you come into the office, we ask you a series of questions and just try to figure out, is that normal for you or not? Sometimes it also takes time. So sometimes people think that in one visit to the doctor that you're going to figure out the answer that day, but sometimes we have to get to know you and what's normal for you. So I have always been bad with names. My next door neighbor, I've been living next to him for almost 5 years now, and he greets me every morning and says, "Good morning, Desiree." And I say, "Good morning, neighbor." So sometimes we're just bad about names, But if you've always been good with names, but now you're bad with names, then that could mean something. So again, you can't just be very cookie cutter and say that some forgetting names, that means that you have cognitive impairment or dementia. Kind of depends on what your baseline is. So getting to know your doctor and what's normal for you is really important. So having a primary care doctor that you see on a regular basis that can tell, hey, something's not right here because they know you is very important. And so mild cognitive impairment is when maybe you have some problems with your memory more than you should for your age, but not to a level where it's affecting your life. But that's where we want to catch it. Then after that, then you can have various stages of dementia. There's mild, moderate, and severe, depending on how many symptoms you're having. And not everybody that has the mild cognitive impairment will go on to have dementia. So that's scary sometimes when people come to see me and I tell them that, yes, you do have more memory loss than you should have for your age, but that doesn't mean that you're going to get dementia. We have to just kind of keep an eye on things over time. You can go to the next slide. So how do we diagnose dementia? So part of it's your physical exam. You know, if I examine you and I see that your right side of your body is working differently than the left, that could mean you had a stroke. If, you know, I examine you and I see that you're having a lot of tremor, could you have Parkinson's, and that's what's causing your memory problems? So examining you tells us a lot about the possibilities. A lot of times we'll do some routine blood work because there are medical problems that can affect your memory. So for instance, if you have a thyroid problem or you're having liver problems, kidney problems, vitamin deficiencies, those all can cause memory problems, but they're important to know about because if we treated that underlying problem, then it could make your brain function better. And then another thing that we do in the office, it's called a MMSE. It's a mini mental status exam. So it's a standard battery of questions like what's the date? We ask you to spell something forwards and backwards. We might have you draw a clock and some other things. It takes maybe 5 or 10 minutes to do. And then depending on all that, then that helps us determine, do you need a CAT scan or an MRI to look at your brain better? And then there's another test called neuropsychological testing, where if you do pretty well in the little in-office testing, then we need something more in-depth. And so in that test, it's a 3 or 4 hour test where they sit down, you almost feel like you're back in school. They give you a standardized test to take, and they ask you to remember passages of something you've read. They ask you to remember words. They ask you to remember pictures. They'll have you do a complex drawing. So it's just a little bit more involved, and that can be really helpful when maybe the symptoms are at the early stages and we're trying to figure out, is this normal for your age or not? Because at the end of the test, they compare you to other people your same age and education level. Because of course, you're not going to expect someone that's 40 to do the same test on the test as someone who's 80. And you're not going to expect someone that has an advanced degree to do the same as someone that might have not finished high school. So they factor all that in to really get some idea. The other thing about neuropsychological testing is that with that testing, they do an assessment of your mood, because one of the things that can affect your memory is your mood. So if you're super anxious or very, very depressed, then that can be the reason for your memory problems. But it can be a little bit of a chicken and the egg. So say that you have very bad memory problems, that can make you anxious about what's to come, or it can make you depressed because you're not able to do your day-to-day function. So that test sometimes can help us sort out how much of it's your mood causing your memory loss and the other way around. So next slide, please. So again, trying to sort out, is this normal for your age or not, can be a little difficult. So these are some of the things that we try to look at. So is the memory loss disrupting your life? Again, are you getting lost and you can't get to the grocery store? Are you getting lost and can't get to your job that you've been working at for many years? It might make it difficult to plan out things. Normally, you might be able to decide you're going to make a cake. And so you know all the ingredients that you need. You go to the store, you get them, you follow the recipe. Someone that's beginning to have dementia or memory problems, they might not be able to follow the steps in a recipe anymore, or they're doubling different parts of the recipe and omitting others. And then it might make it difficult to do familiar tasks. So I have people that have dementia where they have the remote control to the TV, but they think that that's the way to change the thermostat or vice versa. So everyday little things that you take for granted, being able to turn on and off and on your TV or turn on the dishwasher, become difficult for you. Another thing would be getting confused about the time or place. So I have people that will come to see me, and one of the questions I ask is, where are we right now? And they'll say we're at their house, even though they can look around the room and see that we're in a clinic. Or you might have people that it's 2021, but they think that it's 1982. So sometimes that's wishful thinking. Maybe 1982 was a good year. Another thing is maybe you don't understand images or spatial relationships. So people that have dementia might start having problems like navigating through a door because all the calculations that your brain needs to make don't work. And so it doesn't get you right in the middle of the door. Maybe you're off to one side or another, you're bumping into things. And that might also be the reason why you lose things, because normally if you put your keys on the table, your brain kind of takes a snapshot of the key in the table to remind you where they're at. But if your brain can't link those two objects together, now you have no idea where you put your keys. So those are some of the things that help us determine, if it's normal or not. But again, sometimes even after asking all our questions, we have a hard time deciding if it's normal or not. And then we'll do that neuropsychological testing to get a better idea. Okay, next slide. Some of the other things that can happen, you might be having problems with your speech. Many people that have memory problems or dementia will search for their words all the time. Again, in normal conversation, sometimes you might not be able to come up with a word. You'd be like, give me that whatchamacallit, or give me that thing. But people that have dementia, they can't even get a sentence out because they can't pull all the words they need to complete a full sentence. You could misplace things, of course. You might have poor judgment. We have patients with dementia where they don't realize that maybe it's not a good idea to spend their whole check on lottery tickets. They don't think through the complexities of knowing, well, if you spend the money on this, you're not going to have it for that. And that gets them in trouble. Unfortunately, that is taken advantage of by a lot of telemarketers. They call people hoping they have a memory problem, and people will order stuff that they didn't need. And when it comes, they don't even remember that they ordered it. It can create a lot of financial problems when you have dementia. Can get you into a lot of trouble. Another thing is that, again, as we were talking about earlier, sometimes with memory problems, it affects your mood. And so people, if they know that they're having a harder time remembering names or a harder time coming up with their words, they may not socialize as much anymore because it's embarrassing to them that they can't think of what they want to say, or they might lose their train of thought while they're talking. So I've had people that maybe they were in the church choir and they stopped participating because they can't remember the words to the songs anymore. Or I've had people that maybe their job requires that they give speeches, but now they worry about not being able to do those kind of things. And now it's a downward spiral because in order to keep your brain healthy, you need a certain amount of social interaction. So if you're cutting yourself off from everyone, what started off as a mild problem can get even bigger. And again, same thing, changes in your mood or personality. I had a woman bring in her husband, and she said that she knew something was wrong because normally he's very irritable and he gets grumpy about a lot of stuff, but now he was sweet as pie. So she said, I know something must be wrong, because she knew that wasn't his personality. Or you can have someone that normally was very nice and just would never say any swear words or anything, and now they're cursing all the time and very belligerent. So those sometimes can be symptoms that there's something wrong. Okay, next slide. Okay, next slide after that. So again, you're not going to wake up and just not know your family when you were normal the day before, unless there's something that's happened like a stroke or something like that. But something like Alzheimer's, it doesn't progress that fast. It's a process. So first you'll start off in early stages, which is mild, little forgetful, maybe having a little issue with balancing your checkbook, little issues with small things. And then over time, then that can go on to be more moderate dementia, where you're having even more problems doing your day-to-day tasks and more forgetful. Late stage dementia is where You might not recognize your family. You might not be able to figure out how to put on your clothes. You might not remember how to do your day-to-day hygiene or feed yourself. So at that point, you need almost total care. Sometimes this is provided at home by caregivers and family. Sometimes it gets to be so much that it's just people are not able to care for the loved one at home. And that's when people will be in a memory care facility or some other facility where they can get more help. So again, you could start off with mild dementia, and it could take you 5, 10, 15, 20 years to get to the point where you need that level of care. So it's important, though, to try to figure it out at the beginning stages rather than later at the end when maybe there's not as much we can do. Next slide. So mild dementia, again, you might not know the right word that you want to say. You might forget something that you just read. I've had people realize something was wrong because they were trying to read a book and they had to keep reading the same passage over and over. You might, if you're working still, maybe there's a new computer program and you just can't figure it out as hard as you try. You also might have problems with planning things out. So you might want to plan a trip, but you just can't get it together to, make your hotel arrangements, make your airfare and all those things. Next slide. And then moderate, you're going to just continue to have problems remembering things. You might not know your address, or you might be confused about where you are exactly. And you might need help with just day-to-day things that you took for granted before, getting your clothes inside out, that kind of thing. And then you can start to have more problems with your personality and behavior and get really agitated. When people come to see me to find out if they have dementia, a lot of times the person that comes with them will slip me a note, or we find some way for me to talk to them separately, because our brains like to present the best versions of ourselves. So a lot of times the person that has memory problems, they're in denial and they'll get mad at their family for telling on them, or they think that they're exaggerating things. So it can be a little bit of a challenge to get the information. There's been many times where people came by themselves to see me, and maybe they did pretty well on the little easy questions I ask in the office, and they think they're fine and they're not able to give me examples. And then I'll talk to their family members later and they'll give me this whole list of examples. So it's really important, if you suspect someone that you care about has dementia or a memory problem, that you find a way to go with them to the doctor, or at least find some kind of way to let the doctor know your concerns before the visit. Otherwise, someone that's really smart can kind of fool us, and then we don't realize that there's a problem. Next slide. So severe Alzheimer's, that's when you're going to need a lot of help, whether it's caregivers at home or in a nursing facility. And eventually, like we're showing on the brain, Alzheimer's, it starts off mainly affecting your memory, but then it can start to affect other parts of your brain, your vision, your balance, even very simple things like swallowing can become difficult for you. And then it's difficult because you're almost locked in your own body. You're not able to respond the way that you want and make people understand what you need. Almost kind of like going in reverse, where, if you have a toddler or a baby, sometimes it's hard to understand what it is that they need. Are they hungry? Are they tired? You don't know because they're not able to communicate with you. So that's kind of what happens as you go through the stages of dementia. You can get to that point where you're not able to let people know what you need. And then that comes with a lot of agitation and irritability because it's frustrating. Next slide. So what can we do about it? That's the difficult thing. Unfortunately, we don't have a cure for dementia. So right now, the main treatments are trying to at least slow down the progression. So you can go to the next slide. So one thing that they're working on is trying to see if maybe there's a way. It's thought that there might be some plaques that build up in the brain, and that could be the reason for your memory loss. So there's some medicines that they're trying to work on, including this current one that they've been advertising on the TV. It just got FDA approval, called Aduhelm. And the theory is that if this can go in and clear out those plaques, that could help your memory. The problem is it's not clear if those plaques are really the cause of the dementia or just a result of Alzheimer's. So it's not clear if cleaning them out really helps the brain. The other thing is that there can be some side effects from the medicine. You can go to the next slide. So to take that medicine, it requires some testing because you want to make sure that someone has Alzheimer's. As I said before, there's some other types of dementia. If you think that it might be Alzheimer's, you're probably right most of the time. But in order, because this medicine has side effects, you have to prove that it's more likely than not that it's Alzheimer's. So you have to have a PET scan or a spinal tap, and that can be expensive. It only comes in an IV, so you can't take this at home. So it's costly because you have to come into the clinic and they have to give it to you via IV. The other thing is that it can cause some brain swelling. So you have to get frequent MRIs of the brain to make sure it's not harming your brain. So we were really excited as neurologists to have a new treatment because it's been many, many, many years since there's been any new treatments for memory loss or dementia. But this medicine, it might not be the panacea or the great hope that we were hoping for. So here at Kelsey anyway, we're still weighing the pros and cons of it. There's been, if you Google it, there's been a lot of controversy about it. There are some doctors that were on the review board for it that resigned after it got it approved because they felt so strongly that it shouldn't have been approved. And lots of opinion pieces that you can read about neurologists and dementia specialists and giving their opposition to it. So I hate to disappoint people because a lot of people were excited that this was going to be finally a great treatment. But the good news is there are some other medicines that they're working on that might be more promising. Next slide. So there are some medicines that we have that don't cure dementia, but they can slow the progression. The most popular one is one called Aricept, or donepezil is the generic for it. And then there's some other medicines in that same family. There's galantamine and rivastigmine. They kind of do the same thing. Sometimes we pick which one just based on your insurance coverage. Most times Aricept is covered, so we start with that. Excuse me. So then there's another medicine called memantine or Namenda. It works in a different way to slow down memory loss. Sometimes we'll use them together, one from the first category and one from the second category. The donepezil, sometimes it can be hard on the stomach, so people have to take it with some food, but there's some people that it bothers their stomach so much that we just can't use it, and then we'll use the memantine. Sometimes the donepezil also can affect your heart rate, and so there have been some people that had to stop it because of that. It made them pass out or have other heart issues. So those are the main treatments. So, but we try to use those medicines for people that definitely have either cognitive impairment or dementia. A lot of people are just having a little forgetfulness and they think, oh, maybe I should just take that to keep from having dementia later. But they haven't proven that taking it early keeps you from getting dementia. And it's a medicine and it has side effects. So we try not to give it unless we absolutely have to. You can go to the next slide. Then there's some other things that we try to help with. So again, some people that have dementia get very irritable and very belligerent. So sometimes there's medicines that we have to use to try to help with their mood or some of the personality changes. This medicine is talking about a new medicine that they're trying to use to help with sleep, because a lot of times dementia can affect your sleep-wake cycles to where people will be up at night and then sleeping during the day, almost like little kids do. And so sometimes if you can regulate your sleeping patterns, that could be another way to help with dementia. Next slide. So doctors in our training, we learn about prescription medicines. They're trying to get better in medical school about educating us more about holistic therapies and supplements and that kind of thing. But sometimes people will get mad at me because, they're like, oh, all you want to do is give me pills. But that's what doctors do, pills, and we do diagnostics and that kind of stuff. So really, if you're looking for more of a holistic approach, then usually that's done through more of a holistic doctor. So, but medical doctors are trying to get better about trying to integrate the two. So there's lots of supplements that have been touted to help with memory. Most of them don't have a lot of scientific backing. So sometimes if I have someone that has some minor memory problems, they're not at the point where I think they need something prescription. We'll talk about some of these supplements just because there's something to be said for feeling like you are being proactive. It's hard to just sit around and wait and see what happens. So there's a lot of people that they want to take something, and so they need my help in making sure that that something isn't going to give them more problems than they started off with. So these are some of the supplements that sometimes people will take. Next slide. These are some more supplements. The other thing, one more slide, go forward. Yeah, so there is another, there's Nerivia, and there's one called Prevagen that people ask me about all the time. Again, I don't think anyone has proven that they help spectacularly. I think in most cases, those aren't going to hurt. So they're okay to try. They can be expensive though. So before you take anything, always ask your doctor. Some doctors are very anti any supplements. Some are kind of Google them for you and see what they think. But it can be difficult to know whether those help or not. And so one of the things that has been proven to help, but we don't like to think about, is diet and exercise. We like to take a pill that's going to fix everything. It's going to, make our wrinkles go away, make our hair longer, make us skinny, make our memory better. But unfortunately, sometimes it's the old-fashioned way. What you eat affects your brain. So trying to, eat more fresh vegetables and fruits, trying to watch your red meat and meat in general, trying to watch your dairy, all those things can affect your memory. And then exercise. You don't have to run a marathon. You don't even have to do a 5K. Just getting out in your neighborhood and walking and doing some exercise, it boosts the circulation to your brain, and that can be very helpful. Also, just some fresh air, change of pace, helping your mood helps your brain too. Next slide. Go on one more slide. So they're still working on some other things to try to help with memory. There's, finding more ways to see if boosting circulation can help your memory. They've done studies on cholesterol medicines because it's thought that cholesterol plaque might affect your memory. So they're doing studies on that. Trying to find out if there's any other substances in the brain that by removing them would help with dementia. So there's lots of things on the horizon, so we're still working on it. Next slide. So that's the end of my talk. I've said a lot, but really at the end of the day, if you're concerned that your memory isn't what it should be, you should start with your primary care doctor. They can do some of the preliminary stuff and see if they find anything, whether it's your medication that could be slowing down your memory. I failed to say a lot of pain pills and sleeping pills, those can affect your memory, or people take Benadryl to sleep, that can affect your memory. So just looking through some of the basic things with your primary care doctor first is important, but oftentimes if they don't find anything like that and they're concerned, then they'll send you to a neurologist to do some more treatment and workup. So we can open it up for questions now.
Thank you so much. That was a wonderful presentation.
Thank you.
Yes, so we will open the floor for questions. You can definitely add questions into the chat box, or if you are comfortable unmuting yourself. I know sometimes it can be hard to get a more lengthy question into the chat box. So we're a smaller group. If you'd like to unmute yourself to ask your question, you are more than welcome to do that as well. I will get us started with the first question.
Okay.
So having any kind of memory issues, or even if it's, just slight memory problems or dementia, it can be very stressful and upsetting. So I was curious to know if you had any resources that you offer to your patients who are struggling with memory loss and also their family members who may be serving as caretakers.
Mm-hmm. So yes, just like, if you have a bad knee and you can't get around like you used to, when your memory isn't doing what you want it to do, it can be very frustrating, but unfortunately it's just a fact of life. None of us are going to have the same memory as we get older as we did when we were younger. So through the Alzheimer's Association, I think it's like alzheimers.org, or alzheimersassociation.org, you can find a lot of information about dementia. Even if you don't have dementia, I think it still helps to look at that website because they have lots of resources about memory and some of the things that you could do to improve it. They have a lot of support groups, so that can be very helpful. Sometimes, though, we do send people to see a counselor to talk about it. And sometimes people actually get depressed once they get that diagnosis. So sometimes people also have to see a psychiatrist, and then the psychiatrist works with the neurologist. So, but I think the first step is recognizing that, it's tough, and it's tough to have any kind of chronic disease. So reaching out to your primary care doctor, they can also give you resources, talking to friends and family, and not keeping it bottled, up inside. In general, women, sometimes we're better about talking to girlfriends or talking to someone about stuff, and guys might try to be more stoic. But in general, all of us need to do a better job about, reaching out to people, regardless of what our condition is, just to get some support. So.
Okay, thank you.
Mm-hmm.
We had a question come into the chat, and it's, what is the connection with thyroid disease and memory loss?
So your thyroid helps to regulate a hormone. So it regulates a lot of functions in your body. So there are lots of parts of the brain that respond to your thyroid hormone. So when it's depleted, so when it's low, then that can affect your memory. So a lot of times if we find that your thyroid's not working and we get that treated, then that can help your memory. So it's because of the hormonal effect on the brain that the thyroid controls. That's how it affects your memory.
Thank you. So the next question that I have, you mentioned towards the end of the presentation, lifestyle changes, diet and physical activity. For some of your older patients who maybe haven't been physically active for a while, or maybe they're a little hesitant to start, a regimen, what kind of exercises or activities do you suggest?
So it's legitimate that, sometimes as we get older, our balance is bad. So we don't want someone to go outside to walk to help their brain and their heart, and then you fall and you break your hip. So sometimes if you do get out, you want to walk on somewhere that's a little bit softer in case you did fall. So like a track at a school or something that has a grassy area that you could walk instead of just hard concrete, just in case something goes wrong. But if you wanted to do something indoors, there's lots of, you could get like a bicycle, a stationary bike. There's even ones that sit down lower. So if you do have balance issues, you don't have to worry about falling off. There's even ones that just, you pedal, that you could do while you're watching TV. Also, you could just do some light weights, while you're watching TV, just kind of lift the weights while you're watching. And there's, oh gosh, if you can log on to the Zoom, you obviously know how to use a computer. So many different, if you just Googled senior exercises or easy exercises, there's lots of little online exercises that you could do. But, just starting somewhere, starting slow. Again, you don't have to do anything major, but just to boost your circulation is important.
Thank you. The next question in the chat, do you have any words of advice for caregivers trying to understand how a patient might be able to dress themselves one day and have no idea what that even means the next?
Yes. So a lot of times people have good days and bad days. Again, sometimes people that have diabetes will have a day where their sugars are high, but they haven't changed their diet or eaten anything bad, they just spike. Or same thing with blood pressure. So same thing with your brain. Sometimes there's good days and bad days. Sometimes it might be what you ate or how you slept the night before, but sometimes there's just no rhyme or reason to it. So for one thing, the days that things are going good, then you should really cherish those days, because knowing that those days might not be there all the time. And then I think just trying, I think that's the main thing, just trying to realize that, in everything, there's going to be good and bad days. But sometimes it can be so much so that you'll think, gosh, like, did the dementia go away? Because people can have these moments of clarity. So you just have to kind of grab onto those when they happen. Another thing that I would say for caregivers, though, is that, whenever I have people come to see me and they have dementia, I do spend some time talking to the person that comes with them if they're their caregiver, just to see if there's anything bothering them. I mean, really, when you have a dementia patient, you have two patients, them and their caregiver, in my mind, because if the caregiver isn't doing well, then they can't take care of the patient with dementia. So just, using that opportunity when you go to the doctor with your loved one to let them know how you're doing. And sometimes they can, almost do like a 2-for-1, like I do sometimes, and try to help you both.
Okay. So the next question that I have, we see stuff sometimes that talks about, the importance of brain activities that can help to with your memory, things like puzzles, learning new skills. For someone who maybe doesn't have memory problems yet or is in the beginning stages of suffering with issues around their memory, are these things that you suggest?
I think you should definitely do something you enjoy. Like, I don't like Sudoku. I don't like that number game. And so I never want to do that. So you should do something you enjoy, because otherwise it's going to be depressing. So if you don't mind crossword puzzles or word searches or playing solitaire, then you can do those things. Sometimes there are a lot of different programs on the computer that you can do, little brain teasers and that kind of thing. Just reading in general. So if you are a reader, again, some people hate reading, but reading in general and just trying to, kind of test yourself as you're reading, those things are all good. And then social interactions. So sometimes it doesn't have to be brain teasers and that kind of stuff, but just having like a good conversation or discussion with somebody about a topic, that keeps your brain going too, whether it's politics, as long as that doesn't make you too mad, or, talking about current events. All those things keep your brain healthy too. So it doesn't have to be like, a lot of people, there's stereotypical, okay, do some word searches. It doesn't necessarily have to do that, or puzzles, or sometimes people do these adult coloring books. Just something that is keeping your brain active is important.
And then my final question that I have for you is if you have any final words of advice or one thing that you want us to take away from today's presentation.
I think mainly that knowledge is power. Sometimes we bury our heads in the sand and maybe our memory's fading a little bit and we just try to avoid even talking about it. But I think it's important to, get it checked out. The earlier, the better. And, not be afraid to look into it. And then if you have a loved one that seems to be having some issues with their memory, trying to be supportive with them. Sometimes if they're in super denial and really like, there's nothing wrong with me, I'm not going to see the doctor. I've had people, maybe they came to see me and the reason for the visit said dizziness. But again, they've kind of told me ahead of time, passed me a note or something saying, I really need you to check out the memory. Most neurologists can find a way to segue from, well, now you're feeling dizzy and, that involves your brain. Let me just check out your memory a little bit to make sure that's okay. So we have ways to backdoor and check out the memory. But just, we live in Houston or wherever you live, there's doctors. So, take advantage of it, see somebody and see what's going on.
Fun little fact, I used to work as a scribe. And I always admired the physician that I worked for and his ability to kind of navigate the conversation in a way that, we talk about what you want to talk about, but here's what I know is really going on and making them feel comfortable and opening up in that way. So that is awesome. Okay, so we have one more question in the chat. I do want to note if you do have questions, now is the time to go ahead and get those in. So another one just popped up. The first one is, what is white matter disease?
Okay, that's a good question. So there is the gray part of your brain, which is the outer shell and also called the cortex. And then there's the inner part of your brain called the white matter. And so the white matter has a lot of the connections from the outside of the brain down through the brain into the spinal cord. So sometimes there'll be some changes in that white matter. Usually it's from circulation. So if you have high blood pressure or diabetes or high cholesterol, or you smoke, that can cause some circulation changes that manifest itself as little small changes. If you're looking at an MRI, it might look like little white dots. If you're looking at a CAT scan, it might look like dark areas. So that's what white matter disease is. Sometimes if it's very minor, it's probably not interfering with your brain function. But the more it accumulates, then that can be a source of what we call vascular dementia. So you can start to have dementia because of those changes. So if we find that on a scan, then that usually prompts us to make sure that we're controlling all the things that we can do to keep your circulation up to your brain.
The next question. So is it inherited? Is dementia inherited? Is there some genetic components behind it?
Mm-hmm. So sometimes, yes, the majority of cases, no. Unfortunately, dementia is common enough that you're going to have a few family members with it. But if you have very early onset dementia, like say you get dementia in your 30s or 40s, which is almost unheard of, or 50s, then sometimes that has a genetic component. Or if there's lots of members in your family, you have 2 aunts, an uncle, your mom has it, you have a brother with it, then sometimes we'll think that it might be genetic. There is some genetic testing called, it's called the ApoE gene that can be done that can look for genetic causes. But in general, we don't necessarily do that testing because, again, we don't have a cure for it and the medicine is going to be the same regardless. So usually we go by the symptoms and treat it without doing genetic testing. But again, ignorance is bliss. So if you've never met anyone that has dementia and you can't find your keys, you just deal with it. But if you have a loved one that has dementia, then it can freak you out and you can think, oh Lord, they have it, so I'm going to get it. But that's not necessarily true. So you kind of have to, calm down and realize that just because a family member has it, that doesn't mean that that's going to be the case for you.
Okay, great questions, everyone.
Can you hear me?
Yes.
Okay. What was that gene again? APO?
It's called the ApoE gene. P as in Paul, O, and then E, like elephant.
Okay. Mm-hmm. Okay. And also, the diabetes connection with memory loss.
Mm-hmm.
Go ahead.
So diabetes can affect your circulation, and then lack of circulation can affect your brain, whether it's because you have a stroke and then just sugar itself is toxic to the brain and the nervous system. So when your sugars are running high, then, that's why someone, like if they're having a diabetic coma, for instance, because their sugar is so high that the brain can't function, or if it's really low, your brain can't function. So that's how diabetes can affect your brain.
Okay. So even low will affect it too. Okay.
Mm-hmm. Yes.
Okay.
Question.
Mm-hmm. Yes, go ahead.
My husband had a TBI in 2013,
Okay.
and then was diagnosed, and he's doing great. Mm-hmm. And then he was diagnosed in 2016 with Parkinson's disease. I've heard that Parkinson's can be caused by a TBI. Some people say no, it can't. What is your thought?
So for everyone else, a TBI is a traumatic brain injury. So it depends on the severity of the injury, if it could cause Parkinson's, and sometimes it's the number of injuries. So for instance, there are a lot of NFL players where after multiple concussions, they're exhibiting symptoms of dementia and symptoms of Parkinson's. So I think it depends on the severity of the injury and if you've had more than one brain injury, if it could be the cause.
Okay, he fell down 17 stairs.
Wow.
They were concrete stairs. And I was so not knowledgeable at the time. I don't really know how, but they said that neuroplasticity worked with that and recovered.
Yes.
Great.
So that sounds like
Great.
that was a pretty good injury to the head. So it is possible, but you see it more in people that had an injury to the head and there was bleeding, or if they had to have surgery to evacuate the blood or something like that.
He had two what do they call
the
where
shunts.
they suck the blood out?
Yes, yes. So yeah, so it sounds like that was pretty dramatic and definitely could be the source of later problems. Yes.
Good. Okay. Thank you.
You're welcome.
Those are great questions, everyone. Thank you so much for asking those. So if you are like me and you walk away from a presentation and you think, oh, I forgot to ask this question, or maybe you think of something way later, you can always feel free to email us at healtheducator@thewomensfund.org, and we will work to provide you answers for any questions that you have. I've included a survey link here, but I will also include it in a follow-up email. We would really appreciate if you would take a few moments to take the survey, let us know how you felt about today's presentation, what you liked, what you didn't like, and then also any additional topics that you would be interested in hearing about. Finally, these are our social media pages and our website page there at the top. I encourage you to visit these pages, see upcoming events and programs that we have. We are working to confirm presentations for July around summer safety. So once we have those confirmed, we will start posting them on our website and promoting them on our social media pages. But I thank you all so much for joining us. Dr. Thomas, I appreciate you taking the time out of your day to be here with us, and I hope you all have a great rest of your day.
Okay. Thanks, everyone. Thanks for listening.
Thank you.